Okay, so this patient has had this mass
How old?
for 50 years. They're 56. You can see it's got lots of fluid levels. Additionally, it's expanding the ribs. I'll show you the post-contrast, but the ribs were kind of infiltrated, expanded, enhancing.
I mean,
There's also this mass here in the mesentery that is kind of encasing you can see the flovoids of like this celiac axis.
I mean, plexiform neurofibromas can do that. I don't know if the patient we have neurofibromatosis. I mean, lymphangiomatosis.
Yeah, exactly. So this one to me looked a lot like a plexiform neurofibroma, just like encasing the vessels. This one I had no idea about. We do have like some specialists at Emory who like sclerose a lot of venolymphatic malformations. So I consulted them. They thought maybe this could also be a neurofibroma. Apparently they can have lots of fluid levels. On post contrast, I'll show you. It basically didn't have that much enhancement. What?
Does not carry a diagnosis. No one in your family carries a diagnosis. She just hung the, oh, it's
nope.
I think neurofibroma or lymphangioma, yeah.
Yeah, so on post contrast, like the rib areas were enhancing a lot, but a lot of the other areas were not. This was actually T1 Bright pre. I have to kind of upload my series separately, so I don't have the full thing. But and then the mesenteric mass was over here. Someone's chatting in. Telangiectatic osteosarcoma.
Yeah.
Good thought. So we ended up biopsying this thing, and it came back benign vascular malformation.
Yeah, so yeah, not clipal tendinotomy or some weird thing that's, you know, like a.
Yeah, so I think that this thing over here is a combination of like a venolymphatic malformation potentially. We did put ultrasound on it. I couldn't upload them, but a lot of the cystic spaces didn't have vascularity within them, and they're not enhancing here either, but maybe we thought they could be slow flow. I still think this thing could be a plexiform neurofibroma, so we wanted to tie them together, but the biopsy over here, they did 15 core biopsies, and it bled, and they had to hold pressure for 2 hours, but it was not a neurofibroma.
Yeah,
so
it's the same thing. It's got to be the same. It's like a very low hemangiomatosis, syndrome type thing.
Yeah. So I do have a couple of slides about it. I'm not an expert here. Basically, I just consult mostly the pediatric interventional radiologists who are really expert at this.
Hey, Aarti, it's Fred. How are you?
Good, yes. And Fred, my resident, he's our chief resident, but he's going into pediatric IR, and he's a total expert, and he gave us an awesome lecture about it. So Fred, do you have any comments about, like, these are the broad categories I stole from the International Society of Vascular Malformations.
No, that looks good. I was just going to ask if the biopsy results did they do any genetics on it? Did we get any genetics on what the tissue may have stained for, or did they do any fish or anything like that?
No, I asked Matt Hawkins, and he asked me to send it for, I think it was like ALK something.
Probably like AKT or PIK3CA or something like that, or.
Yeah, and that's actually what I saw in this document. There's a really good document from the International Society, and it's only 20 pages, I mean, which sounds like a lot, but basically it shows, the impression I got was that, like, there's so many genetic affiliations with all these. Yeah, he asked me if they stained for D240 to look for lymphatics. But by the time we asked them to do all this, the patient has essentially been deemed that no treatment was going to help them. She was severely anemic because she was like kind of intermittently bleeding or sequestering into this mass, and she was in renal failure. And they decided, and then she became hemodynamically unstable. They decided that interventional was not going to be useful here. There was some talk about embolizing some of these vessels because there were some little branches from the ribs going into this. I think maybe if it was smaller, that would be one of the strategies. And there was also talk about giving anti-angiogenesis drugs. Fred, do you have anything else?
No, that's pretty thorough. I was going to say if there was any major lymphatic component of it, it would probably be amenable to sirolimus therapy. Because there's a lot of research showing that sirolimus, which is, you know, the mTOR inhibitor, is very beneficial for lymphatic malformations or predominant lymphatic venous malformations. So.
That's interesting. Actually, Nellie, do you remember Steve presented a case of lymphangiomyomatosis in the abdomen, and he said that, I think it was mTOR inhibitors that were going to help with that. They're also helpful for like epithelioid angiomyolipomas. So yeah. And then I just pulled 2 companion cases about neurofibromas. So when I was thinking like this mesenteric thing looked kind of like a plexiform neurofibroma, here's a couple of examples from the literature. They can be very infiltrative, encased vessels, kind of grow in like a weird pattern. They don't have to be mass-like. And here's another example. It's like encasing the portal vein, growing through the portal hilum into the liver. So they can be very odd in the abdomen and kind of just like grow in a kind of growth-like pattern.